So this is the video for canine range of motion. So we always start out with range of motion of the neck first. So in this one we're going to do ventral and dorsal assessment of the neck. So the handler puts one hand on the back of the head and then one hand on the front of the nose and then asks the dog to come down. And then for extension you have one hand on the back of the neck and then you lift the head up towards the ceiling. Then for lateral assessment you place one hand down the side of the dog and then you bend the dog around your hand, trying to keep the head as sort of in a sagittal plane as much as you can, so you're not twisting the neck. So you can see this dog is restricted. The next one that we're going to do is shoulder flexion. So one hand slides down in front of the elbow, the other is over the top part of the scapula, and then you're going to flex up. So this is shoulder flexion. See how the handler is supporting the limb. Then we're going to go into shoulder extension. So you are asked to pick the leg up and then push from the back of the elbow forwards, but keep your hand position the same. Then you're going to do elbow. So you're going to have one hand on either side of the olecranon, either side, epicondyle, sorry, and then you're going to flex up. Then you're going to take it out into extension, and that's elbow extension. Then you're going to do carpal flexion, so you're going to slide your hand down. You want two fingers at the back of the carpus to avoid overflexion, and then you're going to flex round. And then you're going to take it into extension. Then the next assessment is the pelvic limb. So we're going to do hip flexion first. So note how the hand has one hand over the hip joint to feel what's going on in the hip joint. Then she's going to take the cranial part of the stifle, flex the stifle up, and then ask for hip flexion. So that's your hip flexion test. Then to take it into extension, you keep your hands in exactly the same position, but just take the leg out behind the back of the dog, and that's hip extension. Then we're going to do stifle flexion and extension. So you have one hand down the cranial aspect of the stifle, supporting the stifle, and then you flex up through with the other hand. Then to take it into extension, you need to come around the caudal aspect of the dog and pass your hand through. And that's stifle extension. Then you're going to do hock flexion and extension. So you need to hold the distal part of the tibia firmly and flex up, and then just flex the hock and extend the hock without moving the stifle or the hip. So it's really important with range of motion that the joint you're testing, you keep it isolated. And that concludes your range of motion assessment. If you had a dog with a tail, which unfortunately this dog doesn't have, you would do dorsal and ventral flexion of the tail and then lateral movement just to check. And that concludes.